So we're here with Carter today. Carter is here for his second round of liposuction. So what we did was we did the flanks, and Carter was very naughty. He's a nursing student, and he gained some weight. And so what happened was the flanks are looking good still, but we have this extra fat. Now hold your arms down so you can see we want to get rid of this today. So what we're going to do is we're just going to do a little liposuction, which is one of my very, very, very favorite procedures to do. I love doing liposuction. And the reason I like it is because it really gets rid of fat very nicely and very quickly, and it's forever. And so before we didn't have that, but this is where the 5 pounds on Carter went, right here. Right here. And we have, and this is what 5 pounds looks like. Because when he told me I only gained 5 pounds, I was like, no, I think it's a little bit more than that. But if we cut this in half, we could see half of it went right here, and then the other half went right here. Isn't that scary? I did not know this. At least it's not 1 pound. That'd be really scary. You should feel it. Feel that, Carter. That's what we're gonna lose after we have this procedure done, right? Hold it up like it's easy. Okay, so first thing we've done is we've marked where we're gonna do the liposuction on Carter. And so we're just going to clean it off with Hibiclens. And do we have those, what's over here? Great. We're gonna just do this. So Carter, why don't you go ahead and lay down? Yes, please. Yeah, we'll probably have you on your side. So before Carter does this procedure, what we do is we do some labs, and the labs just tell us if he has normal platelets, because that helps the clot, and then he's got a normal liver function as well, and then we look for PT, PTT. Carter is very healthy, so we didn't do any additional labs, but for most people we're going to do an EKG. We're going to send them off to get a medical clearance. And so that's one of the things we do. The other thing you have to do before this treatment is you have to stop using any blood thinning agents, and that would be things like aspirin, Motrin, anything that begins with a G, like ginger, ginkgo biloba, things like that. And you checked his blood pressure and all that stuff? Yep. And he was normal? Good. Good. And you'll see how fast and easy liposuction can be. So Carter, let's have you start out. Did you wipe him down already or not yet?
No, not yet.
Not yet, okay. We'll wipe him down.
Was there anything Carter had to do prior to this?
He had to get his labs. Yeah, he had to get his labs. And then normally people would get an EKG and a medical clearance, just to make sure. There you go, thank you. And also he stopped his any blood thinning agents that he would be on. We also just check and make sure he's healthy, that there's nothing that's going to interfere with us. But you know, this procedure is such a safe, easy procedure that most people will get a clearance for this, even if they have underlying health conditions, because this is so safe. And I haven't checked in the last year or two, but from the time it was invented in the late 80s to the early 2000s, there was not one reported case of death with this procedure using the two-method technique that was developed by a dermatologist. So a lot of people, do you guys, when I'm talking and they're just doing that, just look the camera up here. So a lot of people who don't know this, but this technique was actually developed by a dermatologist, and his name was Jeffrey Klein out of Orange County. So this technique is used by everybody that does liposuction now. So, okay, let's have you roll over on your side for me, please, Carter. Yes, please. And then let's see. Oh, there you go, Carter. Carter's engaged for all of you people out there. We'll have to tell his fiancée that this is happening. I love that.
Who else said that?
Who else?
Small.
Oh, really?
She was like, who's that cute little boy with the big butt?
Mm-hmm.
Oh my God.
She was just building us all up, because do you know what she said to me? She said that I look like I'm too skinny and I need to eat. Like that was the best. I know, I'm like, thank you so much. I haven't ever heard that before. Flat. Oh. I know, calm down, Carter.
because you're a boob guy.
Are boobs still in, Carter?
Boobs?
It is.
Yeah.
Is that your favorite thing in a woman, Carter? Is the boobs? Is it the boobs or the butts? The boobs? Okay, we just learned. Okay. Ashley's boyfriend's here. What's your favorite part on a woman?
Oh, Lord. Better say the brain.
Don't answer that. It's a trick.
Better keep looking. Sorry. No, what is it? No, wait, tell us. What's the first thing that catches your attention? Ashley thinks it's the. Ashley says it's the booty. Yeah, that's what Ashley says. Okay, so here we go. We're going to get started here. And this is the infusion. This is the numbing solution. Now, did we heat this up, Lee?
Yes, I did.
Okay, good. So it's a 2% solution. It's basically comprised of water with a little bit of lidocaine in it and a little bit of epinephrine. Now, Carter, did you have anything to calm you down when you did this procedure?
Not this time, though.
Nope. So he's not on anything at all. No Valium or anything. And so you can see we're just, do we have oh good, we have that.
Yeah, Carter, do you work after this?
I do.
So,
Yeah, so that's another thing that's really nice about liposuction is there's not really a lot of downtime that goes on with this procedure at all. Now he's very fibrous. If you hear this, you can actually hear it crunching when I push it through here. Maybe you can't hear it, but I can definitely. Can you hear that?
I feel it.
how do you know if someone's more fibrous versus less fibrous?
Well, when you push through, you can see it's hard. My cannula it's difficult to push it through. So that's an indication that he's more fibrous. It makes it a little bit more challenging to do the procedure just because it's harder to push the cannula through. But that's okay. We have Carter, how's the pain?
1 to 10, probably like a 4. And it's just the numbing. Just like when you get any other procedure, it's just a little pinch, and then a couple seconds later it's gone. So you just have to breathe through it, and then it's fine.
Fibrous means there's more connective tissue, more, because the analogy I would use is that fat is like grapes on a grapevine. And the grapes are the fat particles, and then the vine is the connective tissue or the fibrous tissue. So for him, he has more of the stem as opposed to fat. So I mean, he still has a lot of fat, but there's more than the average amount of fibrous tissue in there.
Another question we always get is, when we're discussing the method versus the other forms of liposuction, like, is there a point where you need to have, where you can't use the method, where you use the method?
You can use 2 method for every kind of liposuction. You know, the big thing is, did you ever have coolsculpt in that area, Carter? No?
You guys see that points too, they're fibrous too.
Yeah, very fibrous. Because oftentimes if people have coolsculpt before they do this procedure, they're more fibrous. Can you hold this for me, please, Lee? Thank you. Okay, so now we're going to numb them here again. So let's see here. We're going to do, like right here. Okay, and that's just the local anesthesia that we use. And then we're going to just use a little poke. Now, people often want to know which is a better treatment, the coolsculpt or the liposuction. And I have to say, I like them both a lot. I think with the liposuction, ultimately, it's a little bit more aggressive and you're going to have a more dramatic result. Now, in some areas where the fat's more loose, and that would be like on the inner thighs or sometimes on the arms, it gives a very even reduction of fat. So I like it in those areas, but for areas where you really want to debulk things, I think that the lipo is really, really nice. The other thing is it's one and done. With coolsculpt, you have to do at least 2 treatments, sometimes 3 treatments, because you get a 20 to 25% fat reduction with the coolsculpt. Whereas this, you get 50 to 75% fat reduction. Okay, so we're just doing the, what's that?
The color that's fine.
The body shaver? Shaper or shaver?
Well, because it's kind of like the theory that they were telling us in Coastal University is That 20 to 25% is basically just kind of like shaving it down a little bit.
Yes.
You know, just like when you peel vegetables, it's the same idea. You know, you take it takes, you know, just enough, just a little bit at a time, and then you kind of look at it and you determine whether you want to do another treatment or not. But a lot of the times, 2 treatments is enough.
Yes, that's for the cool sculpting. And I have to tell you, I've done both cool sculpting and liposuction of my body. I did my chest with a cool sculpt, I did my upper abdomen with a cool sculpt, and I did my upper flanks like we're doing with Carter with the cool sculpt. And I think it's really good. Now the one thing that Carter violated was that I tell people that they should lose a little bit of weight after they do liposuction, because if you don't, it's really hard to see the results.
What about the other common question is if you get like if you think liposuction is time when he does gain weight or if he does gain weight, is the fat going to go somewhere else?
Well, the answer to that is no, it doesn't go anywhere else. But when we gain weight, some areas of our body just naturally have more fat than other areas. And for guys, it's oftentimes the flanks, like in Carter. And for women, it's oftentimes the arms. It can be the abdomen, the hips, those kind of areas. So when you gain weight, if you have twice as much fat in one area, normally it's going to get bigger just by the fact that it has more fat. So if we even out the amount of fat all over the body, it's just going to evenly distribute the fat. It's not going to stop growing fat here and start growing fat somewhere else, if that answers the question. Okay, so now we just have to let this settle in for 10 minutes. So I guess what we could talk about is we could talk about this great machine that we have here. We're going to be using this mechanical liposuction machine, and what it does is it's an automatic vibration system. So what's going on is it's actually just going back and forth on its own. See this cannula just vibrating back and forth like this multiple times throughout. So this makes it a lot easier to get through fibrous fat. Here we have all the cannulas that we can use, and you can see the cannulas are different, and this one is more shredded, so we may be using this one because it's a little bit more aggressive to get the fibrous material out of there. Let's see here. We have our bag, which you can see here. It has 1 amp of epinephrine in it. It was just a full bag of fluid, normal saline, and then we add the amp of epinephrine. The epinephrine constricts blood vessels so it doesn't bleed. We also have sodium bicarb, which takes away the sting so it doesn't burn when you're infusing. Because you saw Carter was very, very, very comfortable when we were doing the injections. And then it's got 50 cc's of 2% lidocaine. And the lidocaine is the thing that makes it nice and numb. Yes. Oh, sure. So what we're doing is we're going over all the instrumentation we're going to be using on Carter's liposuction of his upper back here. And he had the lower back done earlier, but he gained 5 pounds. 5 pounds. And that's what 5 pounds looks like right there, 5 pounds. Isn't that crazy? And so he gained that weight, and so now we have to take care of the upper flank to balance it out with the lower flank. And so we're going to try to give him that cut V shape that guys like so much. And then here we have the aspirator, and this is the suction, and when we turn it on, you can see it is just a vacuum. And where is it? Right here.
It's connected to the cannula.
Oh, it's already connected. So you can see here, there's suction coming out of here. And so it's just a fancy vacuum cleaner. So what we're going to do is we're going to, when we start the procedure, we're going to start using the cannula inside this area here. And what you're going to see is you're going to see that the fat is going to be sucked into this tube, and we're going to eliminate that fat. That's a very, very good question. You know, putting people under sedation can be a great thing for some people that are really scared of procedures, and we do offer everything from conscious sedation, where you're just in twilight, where you're just kind of floaty and know where you are. I kind of like that the best if you're a nervous person, because that way you can still roll over. To be completely put under, it makes it much more challenging because you have to have a team that'll rotate people from side to side. Because Carter, we're going to work on this side, then we're going to work on the other side. So if you're too far under, it's much more difficult to do a good job with liposuction. This technique was developed specifically for so people could be awake. The advantages are you have the ability to move somebody around, number one. Number two, you don't have the extra expense of having sedation. And number three is you don't have any side effects from sedation. Now, I've had cosmetic procedures where I was under full sedation, and both times I vomited for hours after I had the procedure done. So with this, Carter's actually going to be working after we do this procedure, and so that's another benefit. So he's going to go right back to work because he's a tough guy. He's really a tough guy. Is this the side we started with, Carter, or was it the other side?
And another question for you is, since you gained the 5 pounds, are you going to get on the scale and weigh 5 pounds?
The answer is going to be, unfortunately, no. You know, with liposuction, it's inches, not pounds, and so he will unfortunately not be any lighter. Sometimes people lose like 1 or 2 pounds, but typically not very many pounds at all. 2 minutes, okay. So you can tell where he's nice and numb because it blanches. That's from the epinephrine. So we just want to make sure he's going to be comfortable throughout the whole thing.
Appreciate it.
Carter's very, how's it going so far, Carter?
Easy peasy.
Easy peasy. Love it. Love it.
Now, sometimes patients ask about garments.
Oh yeah, garments. The aftercare instruction for this is you want to wear a compression garment for 24 hours a day for 2 weeks, and then 12 hours a day for an additional 2 weeks. So, and that just helps to keep, because we're taking out the fat, which is between the skin and the underlying muscle. So we want them to connect together so we don't have loose skin. So that's an important thing. How are you doing there? Good. I actually fell asleep when I had mine done.
Same.
The team that did me was really mean though. They said I farted throughout the whole procedure. And I was being filmed also.
Did you check the film?
I did not. I was humiliated.
He's like, I don't want to know.
Another big common question is about scarring.
Scarring, typically there are small scars, but everybody's different. Like when I had mine done, I had a circular discoloration in that area and for about 6 months to a year. Sometimes people do get a little bit wider scar. If that happens, we can always revise the scar. And I think I guess I'll use this cannula. So we're gonna get started. Are we good? Okay, so now we're gonna get started. Can I get that goop, please? We want the cannula to slide nicely in and out, so we put a little bit of ultrasound gel on there. And Lee, if you could do me a favor and hold this so we don't bang his head. Oh, thank you. Thank you, Lee. Okay, we've started the cannula, and you can see it's just sliding in there. How are you doing, Carter? So you can see the fat starting to come out of the cannula.
I know, I'm a little jelly boy.
But, you know, the thing is, I really always try to encourage people to try to lose a little bit of weight, just 5 pounds over a 6-month period of time, because we really want to have the best result. And the only time I ever see people come back and complain is when they've gained weight after they've done this procedure. So it's really important to do a little bit of lifestyle change after you've had liposuction, either whether it's a little bit of exercise or whether it's getting rid of a little bit of sugar, you know, stop putting sugar in your Starbucks or just something a little. When is Day of Beauty? It's in September, isn't it? We are not releasing the date, so stay tuned. So yes, Day of Beauty is our day where we give the best prices of the year. And so if you are interested in receiving those really great deals, you want to get signed up to get on our mailing list, because we do see quite a few patients on that day, but sometimes we do sell out and we don't have enough room for additional people. So definitely get on that list, because we have specials on liposuction and hair transplants and cool sculpting and fillers and Botox. And it's a really fun day because we also have people that we do live demos. We have raffles. Do we do the raffles anymore? We have raffles. And you can meet the reps that can tell you a lot about different things that you're interested in. So it's a really fun day.
How's it feel, brother?
Fine.
I'm sure you
I think I felt like 110, but it wasn't, I was like out of 10, like 4 again. No hot spots, also with him.
You can see we're getting some good fat out of them.
And then another question is he gonna have loose skin?
Oh, the loose skin question is a really good question. Typically, people do not have loose skin because there is significant retraction. Now, the things that are going to impact that are if a woman has had a baby and she's got stretch marks and her skin is really loose and saggy, she's probably going to have loose skin. If you've been a yo-yo dieter and you just have hangy skin, this is not a good option for you. You're probably going to need lipo plus a tummy tuck. Okay, let's try a different cannula. Let's try that more aggressive cannula. Because he's so fibrous, we're going to do a little bit. Yeah, we're going to do that one. It's going to be that one. This one. So we're just switching cannulas. You can see how easy it is. This attaches to the suction right here. And then we attach this piece to the, oops, sorry about that. Let me do this here.
I know the trigger is very sensitive.
Yeah. There we go. Now we're gonna get back to this. Okay, there we go. Okay, we're getting lots of fat here. You can see his fat is white, and that's usually, you see more of a white color in people that have more fibrous tissue, because fat tends to be a little bit more yellow. So along with this fat, we're getting some of that connective tissue that's white. And you can see it's not very bloody, which is great. Yeah, this would be really, it's really nice to have the mechanical liposuction because without this, it would be really a challenge to get this out. I'd probably be sweating right now. How many cc's do we have? 200 cc's?
And then how often will we have to follow up after this?
Follow-up is pretty simple. What we'd like to do is, the one thing that's going to happen that's a little bit alarming is for the first 24 hours, you're going to drain fluid because we put that water solution in to numb up the area. And so that's, some of it we're going to suck out, but some of it's going to drain out over the next 24 hours, up to 48 hours. So what you have to do is we'll put, do we still use maxi pads?
Yes.
So we just put maxi pads on to help with the drainage. And also, that night you want to make sure you're not sleeping on your best sheets and that you do protect your mattress. Because I did actually have somebody who I did liposuction on and I forgot to put a protective cover on my mattress and they bled right into my mattress. I had to throw away my mattress. I think I would have thought of that, but. The way we tell how we're doing with this procedure is I'm going to pinch. And you can see he's losing a lot of that fat, but if you look over here, he's still got a little bit bigger lump than other areas. So. You can feel it catching, that's that fibrous tissue. I'd say just look at before and after pictures. You know, liposuction is a challenging procedure to learn. And the side effect that I don't like is if you, I mean, I'm dating myself, but like Tara Reid had liposuction where you could see the gouges in her stomach. And so you want to make sure that somebody is knowing exactly what layer of the skin to take the fat out of. Because if you go too superficially in the fat, it can leave those gouges and weirdness in the skin. You know, some people will, one thing you want to be a little bit wary of too, though, is people that do the before and after pictures, and then they go from being kind of doughy to being like super cut up, ripped, and all that, because those are fake pictures. And the fake is that what they're doing is they're actually giving them steroids afterwards, so they're getting a steroid body in addition to liposuction. So I always think that that's really false advertising, and they should be required to say they went on how many milligrams of testosterone after they did the procedure, because it's pretty dramatic if you do that. But if I wonder what they'd look like if they went on the testosterone and didn't have liposuction is the better question. So it should be before liposuction and testosterone, after testosterone, and then after liposuction with testosterone. That's the way they should do it.
And then, common for women is, if I get liposuction, what happens if I get pregnant?
Okay, the question is what happens if you get pregnant after liposuction? It really doesn't matter at all to me. You know, we do test to make sure you're not pregnant when you're getting liposuction, because the big issue would be the amount of lidocaine we're using in the epinephrine. So it's not safe to do it if you're pregnant. But after, you know, you have to be careful though, because again, that's during pregnancy you're going to gain weight, and yeah, the weight gain may minimize your results. Okay, so we're at 400 cc's now.
Oh yeah.
Okay.
How soon can the Carter exercise?
You know, I'm a big fan of exercise. Go ahead and roll over on the other side, so we're done there. So I'm like, get back to exercise right away. You know, you have to think about safety precautions, like, here we go, we're gonna do a little bit more numbing, please. Safety precautions, like if you're lightheaded or something like that, you wanna be really careful. So, but I think getting up and moving a little bit after you have the procedure, just a little bit of walking helps. Resuming full activity, I'd say 1 month. But I've gone back to the gym the same week when I've done it myself.
Just
So.
can't work out the areas that.
Yes. Bless you.
Like for example, if you're doing your stomach, like when you go back to doing your crunches or working out your abdomen.
For that, I want to wait a full month. Yeah, because again, what happens if you're doing crunches is that we've taken out the fat and the skin is trying to connect to the underlying tissue. You're going to do this. So you're going to kind of, you're going to potentially have a less desirable result. Okay, so this side is smaller. Yes, much smaller. Because I think before, when we had his initial before and after pictures, he didn't even have any situation on this side, right? Yeah, but that 5 pounds made that happen. So here we go.
When does he see like optimal results?
Optimal results take about 6 months. You're gonna start to see results like in a week though. You see dramatic results in a week. And you can see we're getting that fat out of there really quickly. And this machine is so great for getting through fibrous fat.
Have you ever heard of post-op depression?
Oh, post-op depression. Oh my God, that's such a common phenomenon. And that's where after you have a procedure, you feel sad. And you feel like, why did I do this? And it's really common. And it's more common if you use opioids after the procedure to control the pain. And I'm a big fan of using them for the first day or two, but you want to get off of them as quickly as possible. Because I've had people that have come and said, oh, this is the worst thing I could have ever done, and I wish I'd never done this, I wish I'd never met you. And then they come back a few weeks later and say, oh, sorry, I was on opioids, and so I'm really happy with my result. So be careful with pain medication afterwards. Typically, I just want you to use the opioids like Vicodin or what else do we do? Tramadol? Mostly Vicodin, Percocet, for just 1 to 2 days after. Yeah, it's really not that painful of a procedure. Anytime somebody asks for a week later, I'm like, you need to come in because you shouldn't be experiencing any pain after just a few days. I mean, you'll feel some tugging areas where it's gonna feel a little bit weird, but it really shouldn't be that painful. How are you doing, Carter? Carter, you're good. And you can tell by his face he's not faking it. I have some women that can do demos with fillers in their face, and they'll get 10 syringes of fillers, and they act like it's not painful, and inside they're screaming because it can be a little bit painful. And like I said, when I had this done, I slept, so it really isn't that painful. This procedure, liposuction, it really depends on the area that you're doing and the size. So we kind of base it on how big it is, how big the area is. I think liposuction starts at around $1,500 for a chin, and an abdomen is around 39. Oh yeah, around $3,900 for an abdomen. But this is really kind of half an area, so it might be a little less. Yes, so anybody who's considering this, it's really important to come in for a consultation. Of course, you have to have a consultation, but that way you can see if you're even a good candidate. Because the people who are not candidates would be people who have had gastric bypass, who have loose skin, or somebody who has intra-abdominal fat, so it's visceral fat. So you see people with the extended stomachs, and you try to pinch the fat, and there's no fat. That means it's all underneath the skin and muscle, and so you really have to lose weight for that. It's a big disappointment for people that have it. I am board certified. Yes, I am. That's a very good question to ask. Look at Carter's, people look at Carter's face. And look while I'm doing it. He's not on Valium, he's not on anything. So if you watch while I'm doing this, he's not making any facial expression at all. The fibrous tissue? You know, some people are, with him, if he had had previous liposuction in this area, that would be the answer. Yes, it would be. And oftentimes, if you've had previous liposuction in one area and you want to do it again, I tell people we should probably do sedation because it's going to hurt more because of the scar tissue and fibrous tissue. But for him, it's just genetics. Because we did, and cool sculpting is another reason people might be fibrous. Because when you do cool sculpt, it does create a little bit of fibrous tissue. Just a little bit more. Oh, that's a really good question. You guys are really on top of this. Oh my gosh. We always do ask if you have a hernia before you do this procedure. Typically, a hernia is a break in the fibrous tissue below the fat. And so what happens is your organs kind of pop out through that little breach in the fibrous tissue, in the fascia. And the thing with liposuction is we really don't get that aggressive to tear up that fibrous tissue, but there is an increased risk that you could perforate an organ or a bowel. And so you want to know if you have these. Most people know if you have them. But you can do liposuction even if you've had a hernia and have had surgery, because again, they'll put in a mesh to patch that hole. And typically when you do the liposuction, after that, you stay high enough above it and you don't get aggressive with the treatment. So if there were a previous history of a hernia in this area and they had a mesh down there, I'd be using a handheld cannula and I'd be very gentle with doing the treatment on that area. So I wouldn't do this aggressive liposuction on top of a person that had a history of a hernia. Yes, you can. Typically on the upper arms, we're going to do the back of the arm where the fat kind of hangs down. I don't like to do anywhere else because it can look divoted. A lipo consultation, we charge $75 that can be applied towards your treatment or towards a product or another service. And you can look at Carter's face while I'm doing this. You see, he's not faking it. I mean, you could not fake it with this going in and out. It's very effective, the two-method technique. Oh, good. Well, we'll be glad to see you, and we'll take very good care of you. And we're just about to finish up here.
I know, how long that was like, nothing.
Yeah, you can see it's a really quick treatment. It's really quick. Okay, and we can see by the pinch test, we've got them really good. You may want to make sure that this area is. So I'm going out a little out of bounds, so Carter might feel a little bit. Can you stretch for me, please? Please. Ah, thank you. I know.
We should. Follow his journey throughout the day.
Yes.
Hey Connor, how you doing?
Okay, great. And then let's have you roll over. I just want to make sure the other side looks good too. And if you could sort of stretch it out again. Let's see, we've got really good. Let's just make sure the other side's a lot bigger. Yeah, that's good. Just want to make sure we get the boundaries here. Okay, so that's all there is to it. Carter, you're a star. And so now what we're going to do is we're just going to wrap Carter's abdomen. And you're just going to wrap them up, right, Lee? Yeah. And you can see how much fat we got out of there. So for a little guy, not a little guy, a compact man. So we got almost 700 cc's out of there. So that's how easy liposuction is. It's a great treatment. And I guess we have one more question.
Are there any health issues that would make the person
Health issues. If you're a severe diabetic, that can be a prohibitive thing. If you have very serious heart disease where you're very unstable, yes. But for the most part, we've had people that have had heart attacks that get cleared to do this. We have people that have type 1 diabetes that have been cleared to do this because it's a very safe procedure. There are so few complications. We have the drainage, we have a little scar that he's going to have here. There's a risk of infection, but we almost never see it. I think I've seen infections maybe 3 or 4 times ever. And that's I'm taking the number 1 or 2 and doubling it just because it seems like it's such a low number. So it's a really safe, easy procedure, and I recommend it to anybody who has unwanted fat that they want to eliminate forever. You know, it's the forever treatment. So it's a great treatment. So thank you guys for tuning in, and if you have anything you'd like to hear about in our practice, please send us emails, or what do we call it? DMs. Please DM me. And yes, I wanted to say you could DM me and tell me anything you want to tell me. Anyway, thank you for tuning in. Thank you for watching us on Instagram, Facebook, YouTube, and all of the above. So thank you. Have a great day, everyone.